Hi, I'm Jack Cush with Room Now. This is QD Clinic. QD Clinic is brought to you by Room Now Live. Meetings that matter, meetings that change the way you think. It's going to be a big one. It's just a few days away. Register at roomnow.live. Today's case, who's to blame? Sylvia is a 63-year-old white female who has psoriatic arthritis for the last 7 years. She's not doing well. If you look back at her CDI scores, beginning about 8 months ago, it was 9, then it was 15, then it was 17. Last month, it was 17. Most recent presentation, it's 21, not good. Previously, the patient had been treated with methotrexate, leflunomide, prednisone, and infliximab, and her therapies have changed seemingly over like every 6 months. There's a new drug that gets changed or added. Currently, the patient was taking cyclosporin and etanercept, and this has been going on for about 1.5 years. She's obese. She has high blood pressure. On exam, she has a BMI of 36. She has a tender joint count of 10, a swollen joint count of 6, fingers, MCPs, wrists, and knees. She has stasis changes in her legs and some edema. And the light went out. And her CDI is currently 21. So she's got active disease. Past medical history of hypertension and diabetes, for which she takes metformin. The bad news is Sylvia presents to the hospital with a fever of 102 and short of breath. She gets worked up, gets put on antibiotics. Chest x-ray shows she has pneumonia. She is not doing well. She goes to the ICU. She gets hypotensive. She's found to have sepsis, and she dies. It's a sad story. It happens. The question is, you're filling out the death certificate. What does she die from? What do you put down as the cause of death? I can tell you what the resident would put down. They would put down immunosuppression due to the TNF inhibitor and cyclosporin. Wrong. They could have put down, if they were learned in the ways of psoriatic disease and its linked to comorbidities, the comorbidities killed her. She had hypertension, obese. She could have had an MI. Lord knows. Maybe the comorbidities killed her. Maybe, but I don't think so. It's not on the top of my list. If you really wanted to get play detective here, you'd say those stasis ulcers and the edema, she probably had the beginnings of maybe a skin ulcer. Maybe that's how she got septic. Maybe that's how she died. Well, she had stasis changes that were chronic, and there were no new cracks in her skin or leg ulcers to be pointed out at this point. The number one cause of death here is psoriatic arthritis. Inflammation kills. Everyone wants to blame the prednisone, the comorbidities, the immunosuppression, especially those drugs that they don't understand, that they think are horribly immunosuppressive, that the television says every night, all the stuff when they're advertising, whatever biologic on television, to be worried about infection. And that's just cover your butt kind of advertising rather than really teaching. And certainly infection was the final event, but it was from pneumonia that led to sepsis, and she's at higher risk of infection because of her inflammation. Now, true that other things play into that inflammation that leads to infection risk, including comorbidities, including her weight, including her other past medical histories. But the one that people don't blame is the disease, and that's the 800-pound gorilla in the room that needs to be paid attention to first. This really comes into play when you start thinking about, well, she has an infection. Now what can I use? Well, now you're going to wimp out and not use the most effective drugs because they have a warning about infections with them. Well, the patient is already a high-risk patient. To use lesser drugs in a high-risk situation is to ensure her outcome one way or the other, meaning she's going to be disabled and die from disability and her disease, or she's going to and not have her inflammation controlled. Or does the drug actually cause the death? No, it really doesn't. But again, it really does get complicated when people have all, hitting on all cylinders, meaning it's age, it's steroids, it's comorbidities, it's, the drugs, it's the uncontrolled inflammation. There, adding a drug does seem to add risk, but the risk is already high. In such patients, the risk of having a serious infectious event is often more than 50% in the next year. But you have to get control of inflammation. These are hard cases to manage. I just wanted you to be sure as to why the patient died. Tune in for more QD clinics tomorrow.